Hello, my name is Stijn de Mot and I'm very proud to welcome you on the SmartEducation podcast. As our very first guest today, we invited Johnson McEvoy. Johnson is a chartered physiotherapist in private practice in Ireland. He holds a master's degree in sports physiotherapy and a doctorate from the University of St. Augustine in Florida. He works as a head physiotherapist with Irish amateur boxing since 2003 and was an accredited Olympic physiotherapist in Athens in 2004. He has a keen interest in myofascial pain and dry needling and tends to have a multimodal approach to patient care. He is an instructor with the DGSA and has taught dry needling in Ireland since 2006. Johnson has been teaching dry needling top 30 courses and advanced courses on dry needling lower and upper body in Belgium with SmartEducation since January 2017. And he is teaching in Leuven today. We thought that it would be a good idea to grab the opportunity to ask him to take a seat and ask him some questions, and wanted to share this with all the physios out there. Therefore, without further ado, enjoy the chat I had with Johnson this afternoon. Hello, Johnson. Welcome to the SmartEducation podcast. I have to say we're honored to have you as our guest today for this very first episode of the SmartEducation podcast. Well, we've come to know you as a great teacher for the dry needling courses that we host in Belgium in collaboration with the highly respected David J. Simons Academy for, I think, almost 2 years now. And I have to say, personally, I'm always very impressed when I see you giving lectures and teaching. You do it with so much enthusiasm and you're really passionate about what you do. Maybe you can enlighten me a little bit on where does that passion come from, and maybe in particular your passion for dry needling.
Stan, it's great to be here. Thanks for inviting me, and it's a lovely opportunity to talk to you. I think I always wanted to be a physio. I always wanted to work in healthcare, and not to be too altruistic about it, but I'm enthusiastic about trying to help people, trying to help patients. And I think sometimes I wonder, do I get more out of that than they do? So for me, enthusiasm comes just naturally. I chose the career because that's what I'm interested in. I would find that probably if I did something else, it would be based upon the merit of how much I enjoy it. So I think that's maybe where my enthusiasm comes from.
And then in particular for dry needling.
Whoa, that started when
Because you have a long experience already.
Yeah, I'm dry needling now 15 years, but I started out treating lots of soft tissue and I have an interest in soft tissue pain. So really that started straight after graduation in 1993. I worked in the States for 4 years and then worked primarily in rehabilitation and then MSK, musculoskeletal. I also found that outcomes improved. I seem to see especially short-term outcomes, mobilizing the patient better. And then I got interested in trigger points, bought the Travell and Simons manuals back in 98 and really was self-trained at that stage in manual therapy. And then went to the States in 2003, practiced dry needling and started dry needle in 2003.
Yeah. And when did you come in contact with DGSA as a teacher?
I met Christian since 2005. Since 2005.
Christian, who is one of the founders,
president of the
presidents,
with David Simons and with Ricky Wiseman. And then in 2005, I met Christian in the States at a conference, and we struck up a very close relationship with Jan Dommerholt. And we started to teach courses then in Ireland from about 2006 onwards with Jan and Christian. Yeah.
Over 10 years now that you're teaching.
12 years. 12
Okay.
years, yeah.
Okay, Johnson, so dry needling is known to be a therapeutic intervention for myofascial pain, as you just said. But I have to ask you the next question. In the literature, we can find studies that advocate the use and the benefits of dry needling. But then on the other hand, there are other publications that question the value of treating myofascial related pain with dry needling. Can you help our listeners, the physios, how to deal with this, let's say, controversy that exists? And what's your interpretation? And how should physios do that interpretation of the literature?
Yeah, trigger point dry needling really grew from injection therapy. And part of that grew from diagnostic block. That is blocking soft tissue pain to see did that make a difference in patient pain. Lots of that was based upon the observations of Janet Travell. The trigger point itself has been controversial because it's been quite elusive. It's not a degenerative issue with the muscle. There's some evidence that it may be chemically related, relationship to the neuromuscular junction, release of excessive chemicals within it, and cytokinins, which may then push the pain. Of course, the problem is that may be secondary or primary. So there's some research, and parts of the research, including EMG, maybe nerve conduction, one nerve conduction study, and several elastography studies and chemical dialysis studies showing that we have a better understanding of the trigger point than we did, say, 20 years ago. But it's still elusive. Coming on to dry needling then, dry needling has been shown to have particularly short-term effects in myofascial pain. More recent studies, one study has looked at a 6-month outcome where we saw an improvement over exercise only, an 80% improvement in pain. So 4 times greater improvement in pain. The difficulty over placebo has been addressed in a study in 2010. It was the first attempt, and it's a significant study and a significant milestone. But coming forward in that, it seems that adding needling to therapeutic intervention as a part of a multimodal plan seems to be more effective. I don't see that necessarily as a standalone treatment. I think it needs to be part of education and exercise and everything else that physios do so well. So sometimes it's pain management, but certainly we're looking at short-term effects so far in the literature. Literature is getting stronger, but there's lots of controversies within that.
So you presume that in the future there will be more evidence?
Yeah, I suspect that. I think if we look at the meta-analysis and the forest plot graphs, lots of those are starting to move in favour of dry needling as a part of treatment.
Well, yeah.
Certainly when you compare it.
That was exactly my next question, because I know in your conviction there is a place for dry needling in our profession, in physiotherapy. I myself, I see it as a component, just as you said, of a broader therapeutic plan for certain specific indications. Given your, let's say, impressive experience and background in treating patients, what's your point of view, your opinion on that? Maybe you can tell us a little bit more.
Yeah, I would think that if we're looking at, say, something like neck pain, generalized neck pain, good evidence that may work is certainly as part of a program of care. Shoulder pain, there is some evidence. Actually, shoulder pain, one study showed that we saw better outcomes in function 12 months after than just over exercise. But in terms of pain, that was quite similar. There is also studies on the shoulder showing cost effectiveness. We also need to consider dry needling in the context of other choices patients make, such as anti-inflammatories and the side effects of other treatments they may choose rather than dry needling.
It's not solely dry needling that it has to be the solely.
No, I think that needs to be part of a multimodal.
There is a place for exercise therapy.
Absolutely.
Yeah, of course.
But I think the difficulty with the exercise study is that you assume the patient does that exercise. So either they come in and do it in the clinic, but in the research, they deliver that exercise to the patient. So if you can show that exercise and dry needling have similar outcomes, the one advantage dry needling has is the treatment was delivered. The difficulty with the exercise therapy is compliance. So there may be advantages in terms of patient management. Lots of my patients, we try to encourage them to exercise. Lots of them don't. General and specific. But adding needling to that package of care seems to be helpful.
Okay.
Not as a standalone.
Another thing that I wanted to know your thoughts about is the importance of safety guidelines. I think that's very important to mention, that whoever is using dry needling needs to be doing it safe. How much time do you spend on safety guidelines, not only in your practice, but also when teaching?
Yeah, I think safety is of the utmost importance because this is an invasive treatment. I'll talk about the specific of the safety in a moment, but we need to look at a risk to safety balance. So the studies again are suggesting that the improvement, but studies are suggesting dry needling is generally a safe treatment in trained hands. So 2 things. We started national guidelines in Ireland, which included 17 people's input from mostly physiotherapists, 1 medical doctor, occupational health, and we drafted these and published them. They're a guideline document that's available through the Irish Society of Chartered Physios in Ireland, and they guide the physio in specific safety training. They should be part of any training program. Secondly, we then published, 4 of us, I was one of the authors on that, a study on safety and dry needling on people who had completed the DGSA dry needling courses. And we showed that there were minor adverse reactions, bruising, post-treatment soreness. There were no significant adverse reactions. We only looked at 7,500 treatments. But that defines that nobody needed medical care for any side effects seen in dry needling. Surprisingly, post-treatment soreness was not massive. It was a prospective study, but physiotherapy reported rather than patient reported. But it's the first dry needling study, and we showed that certainly at the level of 7,500 treatments, it was generally safe.
Okay, I can subscribe that the importance of the safety guidelines that are brought by the DGSA, so the Swiss safety guidelines, they have an important place in the courses that you teach. Okay, maybe a last question, because I'm curious about what holds the future for Johnson McEvoy. And I mean that professionally. What are the projects that you're working on? What are you looking forward to as for teaching courses? Because maybe listeners don't know that, but you're not solely teaching dry needling for SmartEducation. We had the chance to invite you already last year for an interesting course on low back pain, which will be repeated in January 2019. But what else have you got up your sleeve?
Well, I'd love to continue to see patients clinically. That's what I love a lot. And I think that gains the experience, maybe, and that helps to be able to...
Most of your time is still...
I'm 60% practice. Clinical, and then teaching trigger point dry needling courses. I think that I'm toying with the idea maybe of looking at further research.
Starting up a PhD?
PhD, yeah. I did a clinical doctorate, which 50% of the modules were on myofascial pain. But I'd like to look at maybe an area, certainly in myofascial pain, maybe PhD, yeah. So I'm thinking of that.
So it will be Dr. McEvoy in the future?
Yeah, I think the big thing is that as a clinician, I want to be, first of all and foremost, an expert applier of research, because I think the important thing with research is whether we discuss about treating where the evidence is weaker, but there's evidence where we're not treating with where we have the evidence that's strong. So I think it's important to apply the evidence we've got. We need to clinical reason, read the literature, so that's what I want to do into the future is to stay open. That's the most important thing.
That's
also,
message.
Yeah, in terms of the low back pain.
For every
low back pain is complicated, or maybe we overcomplicate it. Lots of it has to do with education. Kieran O'Sullivan and his colleagues out of University of Limerick published a great paper, Mary O'Keefe and Derek Griffin, on 15 things you didn't know about low back pain. And this was a groundbreaker where the education for patients. So I treat a lot of low back pain. I think empowering patients to be active is number one importance. So going on into the future, I treat a lot of patients with whiplash. I'm putting together a module on whiplash, or planning to put together a module on whiplash. Yeah.
Oh yeah, already, or is it still planning, or already?
I've already got the pieces together, but it's just putting that course together and looking at maybe the management of patients with whiplash.
Which is a very interesting topic.
Very interesting.
Very common.
And patients that suffer. Yeah, lots of research that's hidden in the literature there. Lots of valuable research.
Okay, great.
Thanks.
I thought it was a very pleasant talk. Yeah, it's always a pleasure to talk with you.
And likewise.
We hope to see you, much more of you in the future with SmartEducation.
It's always a pleasure with Belgian hospitality.
Yeah,
it's fantastic to visit, and it's been really my pleasure.
Although you don't drink beer.
No, I don't drink beer much. No, I'm a coffee man, really. Yeah.
Coffee and, of course,
the odd whiskey.
Yeah, that's what we closed down the day, like yesterday, with a good Jameson
and a nice
on the rubbish.
Yeah.
Okay, thank you.
It's a pleasure. Thanks.
So that's a wrap for this first episode of our podcast. If you are interested in following a course with Johnson, which I would highly recommend, I'm very glad to direct you to our website, www.smarteducation.be. For our international listeners, you will be happy to know that we recently launched an English website where you can find all information about the courses we host with international guests. Please visit www.smarteducation.io and find out more.